In Vietnam, more American soldiers were taken out of combat by their own bodies than by enemy fire. Infections, fungal conditions, diseases carried by insects so small you never saw them coming. The jungle was not just the battlefield. It was an active biological environment that treated the human body as a resource. You were 19 years old, 11,000 miles from home, and something was already eating your boots. Here is what happened next. You have been in the jungle for 4 days. You have not been dry for any of them. It started on the first morning. The dew came down through the canopy before dawn and soaked everything. Your uniform, your boots, your sleeping bag, the inside of your pack. By the time the temperature climbed to 35 degrees, the moisture did not evaporate. It converted to humidity and stayed on your skin. The jungle holds water the way a sponge holds water. You are living inside the sponge. Your boots have not dried since you laced them up at Tan Son Nhat. Inside them, your feet have been wet for 96 consecutive hours. The skin has begun to change color. The U.S. Army issued you a hygiene kit before you deployed. It contained a toothbrush, a bar of soap, a razor, and a small tube of foot powder. The foot powder was the most important item in the kit. The Army's own field hygiene manuals devoted more text to foot care than to any other single subject, because the Army had done this before. Korea. The Pacific. Wherever American soldiers operated in wet environments for extended periods, the same thing happened to their feet. The manuals described it precisely. The training addressed it directly. And then you arrived in the Vietnamese jungle and discovered that the training and the manual and the foot powder were addressing a problem that the environment produced faster than any preventive measure could work. Immersion foot, also called trench foot in its First World War incarnation, begins developing after 8 to 12 hours of continuous wet exposure. The skin softens. Blood flow to the extremities reduces as the body attempts to manage core temperature in an environment of sustained moisture and variable heat. After 24 hours, the skin begins to crack. After 48 hours, the cracks are deep enough to bleed. After 72 hours, some soldiers report not being able to feel their feet at all. A numbness that is more frightening than pain, because it means the nerve damage is progressing. The Army recorded over 100,000 cases of immersion foot across the Vietnam War. Most of them were preventable. Prevention required dry socks twice daily, which required dry socks, which required a logistics chain that consistently delivered dry socks to forward positions in a jungle where the helicopter bringing your resupply also brought ammunition, food, batteries, and mail from home. Dry socks were not always the priority. The second thing the jungle does is put things on your skin that should not be there. By day 3 in the field, your uniform is a different garment from the one you were issued. It is dark, with sweat and moisture, stiffened in some places, and rotting in others. The jungle rot, a term soldiers use that the medical literature calls tropical ulceration or cutaneous infections caused by gram-negative bacteria, begins as a small break in the skin, a scratch from vegetation, a blister from the boot, rubbing against skin that's been wet for 70 hours, a cut from a piece of equipment. In a temperate environment, these heal. In the Vietnamese jungle in the wet season, they do not heal. They progress. The bacteria present in the jungle soil and water of the Mekong Delta and the Central Highlands are not the bacteria your immune system was calibrated against growing up in Ohio or Georgia or New Mexico. Your body's defenses are encountering a microbial environment for which they have no established responses. The small cut on your forearm that you noticed on day 2 is now red around the edges and raised. By day 5, it will be weeping. By day 10, without treatment, it will be an open wound that medics classify as a tropical ulcer, a lesion that can penetrate through skin and subcutaneous tissue to the muscle layer beneath. Soldiers who developed these in remote positions, where medevac was not available for minor wounds, sometimes returned from patrols with infections that required hospitalization and weeks of treatment. The jungle does not distinguish between a bullet wound, and a scratch. Both are entry points. The jungle uses both. The insects require their own section because they are not a secondary concern. They are a primary one: malaria. The Plasmodium falciparum strain, present in the Vietnamese highlands, is among the most virulent forms of malaria on Earth. It is transmitted by Anopheles mosquitoes that are most active at dawn and dusk, which is precisely when your unit conducts stand-to, which requires you to be outside and still on the perimeter. The Army issued chloroquine tablets as prophylactic medication. Soldiers were ordered to take them weekly. Compliance was inconsistent because chloroquine produced side effects, vivid dreams, nausea, temporary visual disturbances that made soldiers reluctant to continue. And from approximately 1965 onwards, the Plasmodium falciparum strains in Vietnam began showing resistance to chloroquine. The Army's own medical reports from 1967 and 1968 document the concern explicitly. The drug that was supposed to prevent the most dangerous form of malaria was becoming progressively less effective against it. American soldiers in Vietnam contracted malaria at a rate that the Army's medical command tracked as a separate operational problem. In 1968, the peak year, malaria accounted for more hospital admissions among U.S. forces than combat wounds. This is not a minor footnote. More soldiers were hospitalized by mosquito than by the enemy. The Army knew this. The Army issued repellent, netting, and weekly tablets. The jungle issued mosquitoes at a density that the repellent addressed and the netting partially managed, and the tablets increasingly did not. Dengue fever, scrub typhus, leptospirosis, contracted through contact with water contaminated by animal urine, which describes most of the water in the lowland jungle areas where American unit operated. Each of these diseases had its own transmission route, its own incubation period, and its own presentation. Scrub typhus, transmitted by the larval stage of certain mite species present in the jungle undergrowth, produces a black eschar at the bite site, high fever, and, in untreated cases, organ failure. The mites are invisible to the naked eye. You cannot feel the bite. The first symptom is a fever that arrives 7 to 10 days after the bite, by which time you have been walking through the same vegetation every day for a week and a half. Your water situation requires explanation. The Army issued iodine tablets for water purification. 1 tablet per canteen. Wait 30 minutes. The water is safe to drink. This is the procedure. In practice, you are moving through terrain in August with a body temperature elevated by heat, exertion, and a 70-pound pack. You are sweating 2 to 4 liters per hour. Canteen holds 1 liter. The arithmetic of hydration in those conditions means that the 30-minute wait is not always observed. Soldiers who skipped the wait occasionally, in the wrong stream, contracted leptospirosis or giardia or amoebic dysentery, any of which will remove you from the field more effectively than a moderate wound. Giardia alone produces symptoms: severe cramping, chronic diarrhea, debilitating fatigue that last for weeks after the initial infection and that recur under stress for months afterward. Several Vietnam veterans documented giardia symptoms years after returning home. The stream looked clean. The stream was not clean. The physical environment of the jungle produces one more category of injury that does not appear in most accounts of the war: the vegetation itself. Razor grass, a species of grass with leaf edges sharp enough to cut exposed skin, covers large areas of the central highlands. Soldiers who moved through it without full uniform coverage returned from patrols with dozens of small lacerations across their arms and necks. Each laceration is an entry point for the bacteria already described. Bamboo, which lines the edges of trails and grows densely through the forest understory, has a silica content in its outer layer that produces a specific type of wound, a cut that does not bleed immediately and that introduces fine silica particles into the tissue, which the body cannot absorb, and which produce chronic inflammation around the wound site. Soldiers who received bamboo cuts that went untreated developed hard, painful nodules beneath the skin weeks later. The leeches require no elaboration. Every soldier who operated in the Vietnamese jungle encountered them. They attached between the fingers, inside the boot, through any gap in clothing. The removal procedure became routine. The infections that followed did not. By day 14 in the field, the average American soldier in Vietnam had accumulated a combination of the above that the Army's medical literature described as a load, a cumulative biological burden produced by the environment rather than by any single event. Immersion foot at some stage of development. One or more infected skin lesions. Probable low-level malarial exposure if operating in the highlands. Intestinal disruption from water or food contamination. Leech attachment sites at various stages of healing. Scores of small lacerations from vegetation, each at some point on the spectrum between fresh and infected. None of these individually removed you from combat. Together, they produced a soldier who was operating at a fraction of baseline physical capacity, moving more slowly, sleeping less effectively, thinking less clearly, and carrying a body that the jungle had been systematically disassembling for 2 weeks. The Army's after-action medical reports from the Vietnam War document this pattern with statistical precision. The environment was not a backdrop to the war. It was a participant in it. And unlike the enemy, it was present everywhere, at all times, without pause, for the entire duration of your tour. 365 days. The jungle had 365 days to work on you. It used all of them. Subscribe if this reached you. We cover the parts of history that the official version leaves out every week.